backed by popular demand, the questions that we had about describing, what happens when a patient comes into our clinic and what happens when patient gets a cleaning, we, as promised, we said we would go in deeper about that today. Hygiene with the hygienist. What are your options? I'm going to go into that, and also then what happens after that. So if you'd like to hear more about that, stay tuned. So when you first come in with the hygienist for your cleaning appointment, some people call it a cleaning, some people call it a hygiene appointment. There's a lot of things that happen in that appointment, and I really want to just break it down so that hopefully it changes your perception of what's going to happen and maybe helps you feel a little bit better about going into that appointment. Or, maybe there's some things that you could be getting in your hygiene appointments that you're not aware of. So the first thing the hygienist will do is they're going to lay you back, of course, and they're going to have already reviewed the documentation that we took. It could be x-rays, there could be some probing depths that we did last time. Now, dentists are always going on, and hygienists, and I apologize for this, but we always say, your pockets are deep or your pockets are good. I mean, what are pockets? First of all, I'd like to just quickly explain that. Pockets are, if you think about our neck and as the tooth, and we think about if we're wearing a turtleneck, okay? So we're wearing a turtleneck, and we know there's a bottom to that turtleneck. So when we put our hand in to reach our collarbone, that's where it stops. That's where the bone is. So if you think about a tooth, it's surrounded by a nice sleeve of tissue. And when the hygienist or the dentist is looking for health, so healthy pockets or healthy probing depths, so we use this little probe, it's got a number of measures on it, and a healthy probing depth is 1 to 2 millimeters. That's very small, it's a tenth of a centimeter, it's extremely shallow. Now it can be up to 3 millimeters maybe on the high end, but after that we know we're starting to get into a disease process. So the first thing they're going to do is they're going to go around all the way around every tooth, and they're going to probe into that area. If they start to find some areas are deeper than 3 millimeters, we're going to start noting it as a disease process or as active disease, maybe gingivitis, maybe what we call periodontal disease. Now, when we have periodontal disease, it's sort of a more advanced form of gingivitis. Everybody's heard of gingivitis. It's red, inflamed gums that bleed. But when that inflammation travels down into a deeper level, into the depth, where the bone is, and starts to kind of eat away at the bone, then we're getting into, again, a more serious disease, which can really get out of control. And depending on your health history, for example, your health risks, if you're a smoker, if you're a diabetic, can be really exacerbated by that. So we're going to want to take into account all of your medical history, your things that you do, and your habits and things like that, to think about you as a risk level. So what risk level are you based on these probing depths? And we can really tell also a lot of things about other parts of your health. So we're looking everywhere. The hygienist is always looking in the whole mouth, not just at the gums, okay? So when they probe, they go in, and we find, for example, many areas are good, but there may be one area, let's say there's one tooth that has a deeper probing depth or has something that's bleeding. So we're really going to investigate a little further. We may do a few more photos. We may get a different type of x-ray, but generally we're going to be careful of that. Now, one of the things that we think of when we have a cleaning is we think, okay, there's tartar on our teeth. So that's the big thing. Oh, like I hate it. I always hear patients say, oh, I hate it when they scrape my teeth. There shouldn't be a lot of that in today's world, except for if it's maybe been a very long time. There may be a little bit more. But what the hygienist will generally do is they'll start off with what's almost like a water pick. So almost like a little metal, show you a little metal sleeve, and it basically just vibrates at a high frequency with water to just sort of hammer off or like lightly vibrate off the tartar off the teeth. It's very gentle. It doesn't feel like scraping. The only thing about it is that if you're a patient who has a lot of sensitivity to water or cold water, I guess, we may have a little bit of an issue with that, and I'll explain what we can do to address that in a second. But that just basically goes around and gets the bulk of it off. Now, after that, the hygienist will go in with these finer tuned instruments, and that's where, traditionally people have thought, oh, they're going to scrape my teeth. So they have these very, very tools that will go both above the gums and below the gums, depending on where your probing depths are, where your pockets are, to really get the tartar. if tartar is left behind, for example, or goes many years without being removed, it will advance the process of what we call periodontal disease, as I explained. So that will start to, bacteria will latch onto the hardened film, which is what tartar is. It's sort of a hardened film with, calcium ions and things like that are in your natural saliva that kind of attach to the teeth, and then bacteria attach to that. So if the bacteria has something to attach to that's a little bit rough, like tartar, they'll actually start to the party goes deeper. So it goes further away from the ability of your ability to clean your teeth. And as a hygienist, hygienists have ways to clean teeth that what you do on an everyday practice cannot. We have tools that can go deeper, and there's only so deep you can go at home. Now we know every day you need to do the maintenance, but at home there's only so deep you can go. So the hygienist can go a little further, and if the dentist even needs to go more further, we can actually do other things. But we need to get the tartar out. The tartar is sort of the nidus, or one of the main reasons why the bacteria get to have such a fun time at your expense. So they're just gonna latch onto that, sort of like a Velcro wall for them, and they're just gonna sit there and they're just gonna really party. And in some cases you can have what's called an abscess, which is a really big blow up of the problem, but that's a more advanced state. So if you do come in regularly for your hygiene appointments, you probably will not have that happen. Now, I said, there's risk modifying factors. So there's smoking. Smokers tend to have many more problems with this. If you're a diabetic, your circulation is not as good. Your immune system may not be 100%, especially someone who's immunocompromised or any sort of immunosuppressed situations. So a lot of things have to be addressed and thought of in order to figure out what would be the right interval for you. So some people need to come in, as everybody, most people are, I see the hygienist every 6 months. But some people, it's really not good I don't like to paint everybody with the same brush. I like to really tailor it to the patient. So let's say at first you haven't been in for a very long time and you need to have this done, and we evaluate the tissue response to our therapy, which is removing the tartar. And then, so we bring you back a couple weeks later to see how everything healed, if you are a more advanced case. And then we say, you healed really well. This is going extremely well. You only need to come see us every 4 months for a little while. And maybe we can go back to 6 months or go back to 9 months or a year if things really heal up well. But we don't want to just tell you, listen, you're just going to come in. Every patient in our clinic comes in every 6 months to have their cleaning. That is just not the way we do treatment. We like to customize it. We like to make sure that we're giving you the benefit of having the tissues healed and preventing that tartar from building up. So depending on what you're doing at home, that's going to help us a lot. And then depending on what your medical history is, that's going to make a big difference as well. So it's really important that we, have these sort of discussions to help make you feel a part and understand what's going on. When we do that first part of the cleaning, so we'll do with what's called an ultrasonic. It's got the water, or we do what again people call the scraping. Some people have a lot of sensitivity. So if they feel that they're going to have sensitivity or they've had sensitivity in the past, we try to have those discussions about how we can make you comfortable for that appointment before we even start. So one of the things I will do is we have a couple different ways. So we have a topical gel which we can apply to the teeth and the gums, and that will just sort of numb the area a little bit. It doesn't really profoundly numb it or give you major sensitivity improvement, but it certainly helps a whole lot. So if you're kind of on the fence, you're kind of on the borderline and you don't want to get any freezing for a cleaning, then that's a really good thing to ask your hygienist for. Another great thing to do is if you really need some more deeper cleaning and it's going to be more uncomfortable, I will come in, or Dr. Isaacs will come in, and we will actually give you a little anesthetic in the areas where you really need it. So you can relax and enjoy your hygiene appointment as much as possible. We understand it's not everybody's favorite type of appointment, but a lot of our patients, they eventually do really come to really learn to relax and enjoy those appointments. So you may start your first few visits with us where you have to have a little bit of freezing, and then other times later on in your journey you may not need freezing anymore. So it's really good to think about it that way. And then as a very last resort, you know, some people really are very anxious. So if we can't seem to get you comfortable with our pillows and our, you know, blanket and music and all the things that we do for your experience here, then we can also give you something to help you relax as far as from an oral sedative type you know, approach, and that can be done as well for your appointments. So do ask, don't be shy. We want to help you. We want to make you feel really comfortable during your cleaning appointments, and that's our goal. The last part of the cleaning, sometimes the hygienist, if there's some stain on your teeth, we may remove those stains with what's called an air polisher, or maybe like an actual manual polisher that goes around. That really just removes the stains. It does not actually whiten your teeth, but it may seem like it whitens your teeth because, of course, we remove the stains. And then, you know, after everything's all done, we give everything a nice flossing. We like to talk about, you know, how you can improve your home care. So we like to talk to you about, you know, different techniques that you can do at home, how you can improve your flossing technique, how you can improve your brushing technique, different tools, things like that that you can have. We suggest different rinses depending on the type of problems that you have, and really try to go all out to help you achieve your best oral health. So I hope that was helpful. Absolutely, please send me any comments or message us for any questions that you may have, or something you think I didn't cover. I would love to hear from you, and for sure like and subscribe to hear more content like this. Until then, I will see you next time.